Good evening. Hello.
Hello.
Happy Tuesday. Wow, we made it through another Monday in America. And so that is always something to celebrate. But also we're celebrating American Heart Month this month of February. And so us here at Radio 1 Baltimore, of course, 92Q, and all of our cluster sister stations are celebrating in this way. And what's a better way than learning about our heart health and how we can better take care of it? If you are not recognizing who I am, if you're sort of like, I know that voice, but I don't know that face, my name is Chey Parker. I am 1/3 of the Quicksilver Morning Show on 92Q Jams in Baltimore. And you can catch us on air Monday through Friday, starting at 6 a.m. until 10 a.m., making you laugh, informing you, and also keeping it real, talking about what's real. So make sure you check us out tomorrow morning. I will definitely be recapping the conversation that we have here. Now, I know Pork Chop was initially supposed to be hosting this, but we are keeping him in our prayers. He had an emergency that he had to take care of, but I'm here. We're going to have a great conversation tonight. And don't worry, I will make sure to tell him all about it. So don't worry your little hearts. But we are getting ready to get started with this series guests. Of course, we have to thank all of our friends and partners at the University of Maryland Medical Center Midtown campus. Tonight, I am honored to welcome for the first time to our series, Building Up the Health of the Community, Dr. Darrell Rubin. How are you?
I'm doing well. How are you?
I'm doing great. Thank you so much for joining and for taking the time out of, I'm sure, your busy schedule to have this conversation with us. And you're a first timer. So we're going to get to know you a little better and then also get to know a lot more about our heart health better.
All right, I'm ready.
Yes. Now, if you'd like to find out a little bit more about Dr. Darrell Rubin, he is a board-certified academic cardiologist at the University of Maryland Medical Center, and he sees patients at his Midtown Baltimore office. So those who may be tuning in right now, if you are in the area, and that's right by you, then you already know what to do by the end of this session. Dr. Rubin is also an assistant professor of medicine at the University of Maryland School of Medicine. He has a special interest in integrating stress management practices into clinical care. And we're definitely going to talk a lot about that tonight and how that affects our heart health. But his approach to stress management starts with mindfulness and meditation and includes developing other skills important to self-care and wellness. And we'll make sure to share your information at the end of this session so that anyone that wants to connect with you and get in contact with you is able to do so. Welcome to the series, Dr. Rubin.
Thank you. Thank you very much. It's my pleasure to be here.
Yes.
I heard a lot about it from my colleague, Dr. Hawk. So looking forward to it.
Okay. Well, I'm sure after tonight, after this session, hopefully we will be having you again as well. And we really just like to keep this as real talk as possible. I like to ask the questions that I really want to know, but also I invite our viewers who are tuning in on Facebook, on our website as well, and YouTube, their questions and really getting to the heart of, no pun intended there, but
That was a good one though.
The heart of not only what they need to know, but also what they may be misinformed about. So we are going to hop right in. Now, Dr. Rubin, when we think about heart health, what immediately from your medical perspective comes to mind? Because I feel like it sounds like a really broad term. How can we narrow it down and kind of keep it simple?
Yeah, the simplest idea for heart health starts with two things that everybody understands. It's eat right and exercise. Right. That's the simplest approach to heart health. Like if you're doing those two things, you're on your way. Now we all know those two things, but doing them is can be hard because we're busy, because it's more convenient to eat out or whatever it is, or it's too hard to get to the gym. Um, and so I try to make that simple for people to start. And I start by telling them, and reminding them, number one, they already know how to eat healthy, and that is eating more fruits and vegetables than anything else. Right? We all kind of get that. Um, and the rubric is half your plate should be fruits and vegetables when you sit down to eat. And fruit, by and large, anything with the seeds on the inside. So like, I don't necessarily mean you should have like apples and bananas on your plate for dinner, but like cucumbers are fruit, bell peppers are fruit. Then of course we know lettuce, we know all the root vegetables, all those things can be a part of that one half your plate. The other half, quarter of it, some protein, and it doesn't have to be meat. There are some legumes that have a lot of protein. For instance, a cup of peas has almost as much protein as a cup of milk.
Oh
Uh,
wow.
yeah, it's a crazy thing.
Green peas?
Green peas, right?
I had no idea.
Yeah, green peas. Yeah,
Wow, that's my least favorite green vegetable, and I'm a green vegetable fanatic. Like I
All
love green
right.
vegetables. But
Yeah,
green peas, wow, the more you know. Like I'm
yeah,
learning something new already here.
yeah. Beans tend to have a lot of protein. Peas and other beans. And then carbohydrates for a quarter of it. Preferably whole grains. And the thing I that I ask people to do when they start trying to make their plate look this way is to measure their carbohydrates. Like we all measure our carbohydrates. We just usually use our eyes
Mhm.
to do it. Because I'd like to
And
eat about this
stomachs
much.
too.
Right. So we end up with like, as much as we think we want to eat. And I say to people, just start by measuring that. Like you have already put on your plate what you think you want to eat. Now measure and see how much that is. And then once you're aware of how much you have, and I say now you can start to dial it down. Right. So, I had a cup of rice the other day. I'm gonna try 3/4 of a cup and see how that goes. And stick with that for a little while. And then like when you're ready, you can dial it back to half a cup.
Okay.
So that it can be just a sort of a useful tool, sort of get you on your way. Um, there are other things about eating right, but we can stop there for now. And then the second part of it is exercise, and there are recommendations from the academic societies about how much you need to exercise per week and how high the heart rate needs to be. And I tend for people who are just starting, I tend to treat those as goals for them. I said, look, this is a goal for you. But at the beginning, you want to go low intensity, right? Something that's comfortable, because in the end, you want the habit of exercise to develop. And if you go out and you got your new Under Armour gear on, you got some new kicks, and you go to the gym, you bust it out for an hour and a half, and then you go home, you're exhausted, you hate it, you might not go back for a while, right?
Right. That's
And so
very, very
my whole approach is start slow. Number one, you're not in any rush to get in shape, right? You got you're trying to be healthy as you get older. So start slow, go for a short walk, come back home. I'm a real big advocate of stretching. As I get older, that gets more important for me.
that yes, yes. Every
Yeah,
every day it gets more important.
yeah. It's pretty.
And a
It's
deep
real.
stretch is
Yeah, it's real,
is
man. It's
good.
real. Don't get out
Yeah.
there and get hurt now. Um, and then you can do some exercise in your home, like patients who are able, they can do calisthenics at home, sit ups, push ups, that kind of thing. And like I said, in no hurry, just a few to start with, and you know, even if you just give it a few minutes, every morning, and do that for a year, it counts. Everything counts. Take the stairs, deliberately. Like you go downstairs, turn around, go back up, come back down, right? Everything counts as you're sort of getting yourself in the lane to be healthier. Um, let's see. So I don't go too long on this one,
Oh yes, no,
but
that's
I can go
completely
further.
fine. That's
All right.
completely fine. No, we have a lot more to, get into, but that is a good
All right.
start. And to your point, I feel like it's also a mental mind shift that also has to take place when you're looking to take better care of your heart health. When it comes to, like you said, you're not in a rush. A lot of people are more concerned with the aesthetic result of working out and exercising. You're trying to get to a certain goal or get to a certain number on the scale. And oftentimes we forget that the exercise and that the whole point is also for the improvement of our health, that may not necessarily be so outwardly visible or obvious results. So I think that was an awesome point that you made. And also too with the food, and thinking how to eat better and measuring your carbs and making sure that you have a good portion of things on your plate. Now, I can tell you right now, the food that's available in this country at this time does not offer what you just told us that we need to have on our plates for our meals. A lot of times people are going to McDonald's and Burger King, and they're going out to eat, or they may even be doing restaurants, DoorDash, Uber Eats, all the things. And so do you have any advice for the folks out there who have the right intentions on, eating better and eating right, whole foods, but at the same time sort of lack the tools and the information that they need to make the better choices?
Yeah, I want to say up front, I'm not against restaurant food. I'm not against restaurant food. Just don't have it often.
Okay.
Look, I rarely go to McDonald's myself, right? I had small kids. We get pancakes, right? And that just happened every once in a while. That was what it was, right? So I'm not against it. It just if it's the major way you're getting your food, it's probably not healthy for you,
right?
Because and here's the key. What they're using to make that food usually contains more sugar, salt, and fat than's good for you in the long term. And you can find that out for most restaurants by going to their website and looking at the nutritional facts. The recommendation for sodium intake is about 2,000 milligrams.
Yes,
that's of salt.
Insane.
Yeah. And that so a teaspoon of salt, of table salt, is 2,300 milligrams. So a little bit more than what's recommended. So that that's it for the day. That's actually a lot of salt. And so if you go to the websites and look at the nutrition facts and say, okay, look, the hamburger has X amount of sodium in it. Just log that and say, okay, I had 700 milligrams of sodium. That's a number I just made up. And you have to decide then, how are you gonna eat the rest of the day so that your sodium intake stays at the level recommended.
And how important is our sodium intake to our heart health? How is it tied together?
Wow, that's it's intimately tied. The more salt you eat, the more likely you are to have high blood pressure. And once you have high blood pressure, everything follows from that. Increased risk of stroke, increased risk of heart attack, increased risk of kidney failure. Lots of things come from having too much salt in your diet. And, that can be very hard for people to modify, because our taste buds are tuned for high salt content. And what we say is when we eat food we like, we say that food's well seasoned. But you could just as easily say that food's salty, right? I don't know if you've ever run into that
before. Fair enough.
Yeah.
The saying that I love, that I often use, I have to admit, is that I like to see my seasoning on my food. Okay. I can't see it.
Okay. It's not seasoned enough.
I gotta see it.
Okay. Look, right.
A pinch of salt, does it really do the job?
Right. So that's a good point, right? Because because the taste buds are tuned to saltiness as good, right? And so I don't have high blood pressure, uh, but that's probably 15 years ago, maybe a little longer. I decided I was going to go on a low salt diet because I recommend it all the time to people, and I said I should probably know what that tastes like. And so I did it. My wife was very glad to help me with that. Um, the food was low salt at home, and for about 3 weeks, I was like, this is it's not good. Um, I was like, just I felt like it didn't have any flavor,
Right.
and for me, right around 3 weeks, um, I was eating some cauliflower, some roasted cauliflower. I don't know if you ever had roasted cauliflower. It's delicious.
Yes. Yes.
Yeah, it's delicious. There's no salt on it though, and no cheese.
Okay.
It was just cauliflower brushed with a little olive oil, put in the oven.
No
Comes
garlic
out
powder?
nothing, just garlic. I mean, just cauliflower, right? And then
Okay.
it's a little singed on the edges, right? Because it's been roasting, and it was sweet. And I was like, why? I was like, why is it sweet? There's sugar on this. It's like, of course, there's not any sugar on the cauliflower. Why would you ask that? I'm like, it tastes so sweet though. And what I realized is that I never knew that because I always salted the cauliflower. So it
By
always
just
tasted salt.
habit.
Yeah, it always tasted salty and delicious, right? But roasted cauliflower on its own is sweet and quite tasty. I love it. But I wouldn't have gotten there until I sort of stuck with the low salt diet. And I felt in that moment, I was like, it's kind of weird to say, but cauliflower has its own taste. It doesn't actually need salt because it has its own flavor.
Yeah.
I just can tell that because I'd always been covering it with salt or cheese, and a lot of food is like that.
Yeah.
I roast all my vegetables like now, like green beans, broccoli, cauliflower. Love it, can't get enough.
Now, string beans without any seasoning, what do those taste like? Because I'm not convinced, Dr. Rubin.
It's the same thing. Like I roast mine more than most. Like they tend to be a little darker on the edges, but I really enjoy them. Like without sodium. I do.
Yes.
I do.
I mean, I do have to admit, when I started, significantly decreasing my sugar intake on the other side of things, you sort of train your taste buds. Like the more that you do it, the more your taste buds will actually, begin to, take a liking to taste. It's just really all, I feel like, a matter of habit, and going back again, sort of that mental shift of saying I'm also doing this for my health. Now, what do you think about the saying that you should focus on eating for nutrition, not for enjoyment?
That's outrageous. Who says that? That's outrageous. No,
there are folks out there who are really big in nutrition and fitness and wellness that say, we eat because we have to, not because we should like to or want to.
Oh no, I don't know. I'm sorry that they're living that way. I enjoy my food, right? Like I said, roasted cauliflower is delicious. I actually enjoy it. Roasted cabbage, right? Wow, roasted cabbage. You just take a whole cabbage and slice it like bread.
Oh, wow, I've never roasted cabbage before.
It's fantastic. You just brush it with some olive oil, put some smoked paprika on it, throw it in the oven.
Okay.
And it'll get the outside leaves will get black, but when the middle's ready, oh my goodness, it's so great. I've never eaten that much cabbage in my life, right?
I'm gonna have to try that for sure. Yeah. Now, as
fantastic.
we're on the topic of food, Courtney E. Drake, my girl, her question, and I don't even know if I want to hear the answer to this or not. Is red meat bad for your heart?
Well, that is an interesting question.
Don't break my heart, right?
I would say at the outset, I'm not against red meat. right?
Okay.
But it shouldn't be the major part of your diet, right? You hear people, they say, I eat red meat every day. That's not good.
Okay.
It's just not good for you. Like if you have a steak every once in a while, right, it's probably fine. But when you eat red meat, you're going to get um, more fat in your diet, and that's not good for you. There's some very interesting work by cardiologists at the Cleveland Clinic. His name is Stanley Hazen, where he did some magnificent work on the connections between eating red meat and the development of cardiovascular disease, which I think people have known for a while, but he connected it at a molecular level, and the mechanism went through the gut microbiome. Fascinating work, but it really sort of drives home the point that red meat does raise your risk, and you know eating it sometimes is probably okay, but eating a lot of it not okay.
Ah,
Yeah.
okay. Now I'm not a red meat person every day, but I love
Yeah.
love a good steak.
Yeah,
Definitely.
yeah. I'm the same way.
Actually, just
I
eat
have
one
my steak. I
today.
understand. I have my steak every once in a while, but I have it infrequently.
Okay. Now
Yeah.
another follow-up question from
Mhm.
Courtney E. Drake. Best kind of meat, chicken or just stick to seafood?
Well, so you're gonna get dated both ways, right? Um, if you're eating fried chicken every day, yeah, it's probably not great, right? Because of the oil and the fat and the salt. Um, if you're having lean chicken without the skin, and you're measuring your portions, and you're getting a serving, uh, as a part of a balanced diet, like we talked about, it's probably fine. Fish the same way. Depends on how your fish is prepared. If you're having fried fish, having it every day is probably not the best choice. But having it prepared in other ways and choosing fish that are high in the beneficial fish oils, you know, it's probably better for you.
All right. Great question. I am not the biggest seafood person, but it looks like I'm gonna have to get into it if I gotta give up a few
Yeah,
steaks.
yeah. It's interesting. Like if you go and look at how meat, fish, chicken, beef, how it's being raised, what it's being fed, uh, and how that affects its composition, how that affects us. You're gonna find variable things, even in the scientific literature about how about it. So I think the upshot is that enjoy your meat every once in a while, but focus on the fruits, vegetables, whole grains, and measuring what you're consuming.
Absolutely, for sure. Now, when we talk about heart health at various stages of a person's life, when do you feel people should really start thinking seriously about heart disease prevention and taking steps to do any screenings or preventative efforts that are necessary?
Well, so we all start. So with the some of the main things we think about in terms of cardiovascular health is the developing atherosclerosis, which is getting plaque build up in your arteries.
Mhm.
So that starts to happen for everybody in their 20s, right? It starts to happen, right? And only a very small number of people are actually going to have that get to a point where it makes a problem for them. They have pain as a result, or they have a heart attack or a stroke. Um, and the name of the game is lowering your risk for it becoming a problem, right? Um, you know, the idea that exposure to risk is cumulative. So if you eat unhealthy, from 20 years old until you have your heart attack, there you go, right?
Mm,
If you start when you're 30 and you have a heart attack at 60, right? It's cumulative. So the upshot is intuitive. You should eat healthy as much as you can. And the adage for children is like, oh, those kids have to be kids. They should be able to eat what they want. I think we know that's not true. It's pretty well known, that children who eat a lot of refined foods, high sugar added foods, they develop problems. The rates of obesity and diabetes in children, they're not going down. So you have to be mindful of those things. Now, I'm not saying, like I said, with the other things, I'm not against candy, right? You just shouldn't be eating candy all the time, every day, right? It should, it should be something that is a treat, but not a mainstay, right?
Right.
It shouldn't be something that is, I ate, and I'm going to have this bag of candy. Now, one of my favorite things to point out to people is, the size of candy packaging. And in the last decade, we've seen the rise of the share size candy package. And you know what that means? It's one package, but it has like 2 or 3 servings, maybe 4 servings in it. But the impulse when you buy something like that, you buy yourself, is to finish the bag, right? And it's not meant for that.
Right.
It looks like it should be, because it's not in the party aisle where you have large bags of stuff. It's at the checkout where it's like, hey, here's something for you to eat on the way home. Right. So it's like, that's clearly like, it encourages you to eat that kind of stuff in quantities that aren't good for you. So we have to be mindful of that.
So it sounds like to me, nothing in excess is really good for you. Everything should be balanced and in moderation. And if you're going to indulge in those less healthier things or food items, then make sure that you do it sparingly.
Yeah, now, that's pretty much that's sort of the comfortable way to ease into it, And for some people, we
really stick it to you and say no candy, no soda, no cereals, sugary cereals.
And for some people, they have to have the no option in order for it to work. I've heard stories about people who they drank a lot of soda, for instance, and soda's loaded with sugar. I mean, loaded. It's incredible. Like if you just look at the back of it and see how much grams of sugar per 20-ounce bottle, it can be really mind blowing. You would never sit down at a bowl of sugar and just eat that much, right? You never do that, but you could drink it. Right. And I've heard stories about patients losing 100 pounds after they quit drinking soda. And the question is, well, how much soda were you drinking? Whatever it was a lot, right? Just making that one change, right? They didn't go sneaking back to have a soda every once in a while. They just had to cut it off because they were doing too much, and it had great benefits for them. So some people are like that. Some people are kind of like can tolerate having some because they know they're not going to have it all.
Right.
They can get the share size, have a third of it, and put the rest of it away, right? I don't buy the share size.
I know actually one woman who used to drink 1 12-pack of Pepsis a day.
Wow.
A day. And she was definitely, experiencing health issues. I know me personally, I had to pretty much cut it out my diet completely. Like I may have a soda once every couple of months.
There you go. Yeah.
But it's when you start to look at the nutritional facts, even on the back of things, like you don't even necessarily have to go that far. If you start looking on the back of things, in the grocery store or even on the menus of different restaurants, you will find that it has a lot of sugar or a lot of salt or a lot of carbohydrates. And you're just like, whoa. Is everything bad?
Well, but I can appreciate you saying that because that's the first step is being aware. Like, am I aware of what I'm eating? And then the moment you're aware, you get to make a decision. Is it, am I going to eat this? It's going to align with my goals. Like, is this what I want? Right. So some restaurants will have their chocolate lava cake, whatever it is at the end. And I was in one restaurant, and the chocolate cake, the chocolate cake, just the one, was like 2,000 calories.
Oh,
It's
wow.
like, that's clearly a share size. But
Wow.
yeah, and so now knowing that, if you order the chocolate cake and there's 4 people having a meal, so what we're going to do, we're going to split this 4 ways. Now it's still 500 calories, but you got to make your mind up, right? What's it going to be, right? This is going to be my night that I'm going to have 500 calories. Um, but knowing is sort of the first step in order to decide.
Yeah. Yeah.
What am I going to do? How am I going to live? Right.
Right. Now, what signs or symptoms of heart problems are most common, and what are some symptoms that are most overlooked?
Most common. The thing that comes to mind in terms of like the effect uh, of atherosclerosis in particular are heart attacks. That's what people think of, and strokes. Heart attacks can have a lot of symptoms. The most common thing is chest pain when you're exerting yourself. So you're walking, you're climbing the stairs, you're getting pain in your chest, and that's a red flag. Definitely want to be seen by your doctor, by your cardiologist. Other signs of having atherosclerosis that is significant in the heart is shortness of breath. So same thing, you're sort of exerting yourself, you're trying to do something, you're walking, you're taking the stairs, and you're like, wow, I just could take those stairs pretty well last month, and now it's really tough. I'm getting short of breath. That could be a sign that you're having problems with your heart. There are other things that could be attributed to as well, but definitely on the list is significant disease of the coronary arteries, which are the blood vessels that bring blood to the heart. Strokes are different. The definitely, like, if you yourself notice that you're having trouble forming words, or you look in the mirror and your face is drooping, or you can't lift your arm, those will all be red flags. Somebody else notices your face is drooping, that's a red flag. It's like, hey, what's going on with your smile there? It's like going up on one side. Immediately it's like, okay, we got to get you to the hospital, because got to get it figured out and taken care of.
Yeah. And I would love for Pork Chop to, have been able to be on this live as well, because, he's someone who has suffered with strokes. And I know he can speak to his own personal experience, and has a lot of times as well on air with us. But this is even great information for those in his support system, us at work, with our own health, but also in helping, our loved ones sort of manage theirs and help them, make better choices. For everyone who is just now tuning in to our session, this is the next episode of our series here at Radio 1 Baltimore, Building Up the Health of the Community, Taking Care of Your Heart, presented by the University of Maryland Medical System. We have a chat going right now. Shout out to Courtney E. Drake and also Glenetta for the questions. Glenetta, we're going to get to your question in just a few moments here. But we are talking to Dr. Darrell Rubin. He is not only a doctor, but also an assistant professor of medicine at the University of Maryland School of Medicine. And he has a specialty in integrating stress management practices into clinical care and helping us take better care of ourselves. Now, Dr. Rubin, before we get to Glenetta's question, sort of piggybacking off of our conversation that we were having, when we think about the symptoms and the different signs of starting to develop heart issues, how important is it that we be proactive versus reactive? In the beginning of our talk, you briefly mentioned, a lot of these things, once you have high blood pressure, it's sort of like this spiral to everything else. And that a lot of times, these conditions or these symptoms can be hard to reverse. Can you talk a little bit more about preventative care?
Yeah. So what? Yeah, once you so before before you have a diagnosis, eat right, exercise. After you have a diagnosis, the same, eat right, exercise. Also, you want to take your medicine, right? A lot of people who have high blood pressure require more than one blood pressure medicine. Some people just take one. Most folks have two medicines. Once you get up to four or five medicines, then it's resistant hypertension, resistant high blood pressure, and there's other things that we do to sort of test those people. But definitely eat right, exercise, take your medicine, follow up with your doctor. Checking your blood pressure at home is a great practice.
And we have Glennetta's question here. That's a great segue point. How often should I check my blood pressure?
So, so for people who are just new to blood pressure medicine, or their doctor started the medicine and they want to make sure the blood pressure stays controlled, taking it as often as once a day can be helpful. Writing that information down, putting it, in a memo on your phone, and then sending a copy of that to your doctor, or posting it in the My Chart app. If you go to University of Maryland, and sending that message to your doctor can be very helpful in terms of determining if the blood pressure medicine is effective, whether you need more. And so all that can happen between visits, while you're gathering information. So that's, it's a good practice. And then so after the blood pressure is better controlled, you're stable on your medicines, you can drop back, maybe taking it once or twice a week, and even as low as once a month. It's good to have a blood pressure cuff at home. If you find, I'm having some symptoms, you definitely want to know what your blood pressure is. Right. I have a headache. Well, check the blood pressure. Blood pressure sky high. You got to go to the hospital. It might just be run-of-the-mill headache. Blood pressure is normal. You have a headache. You take a Tylenol. You feel better. You go on about your business. But if your blood pressure is 180 over 60 and you have a headache, you probably should go be seen. If not at urgent care or your primary's office, the emergency room.
Okay. And stress, moving sort of away from the food element, we know that stress is cited as also a heart health risk. And you actually specialize in stress management practices and mindfulness, meditation, different ways we can manage our stress. Can you talk a little bit about how stress and heart health affect Black folk? It is still Black History Month after all. And I feel like we are, a demographic, if not the demographic, who has, the most stress on us, not just, in our physical stresses, like on our bodies, but also mental and emotional as well.
Yeah. Stress is hard on the body. It's hard on the mind. A lot of the sort of bad effects of having stress is how we respond to it. And you'll say, well, because we know, like it's a known quantity that people who are high stress, not all of them have problem, with the heart and cardiovascular system. Hostility as a part of that stress response predisposes people to having problems. That's part of it. So sort of being aware that you're having a stressor and how you feel about it is important, right? We're sort of back to, you got to know before you can change it, right? You got to know how many calories you're getting, how much sodium you're getting before you can make a change. The same thing this way with stress. Like something stressful is happening and I have feelings about it, and I need to respond instead of react.
Yeah.
And that shift from to responding rather than reacting gives you an opportunity to make some changes, right? So some people respond to stress with coping mechanisms that are helpful, and some that are less helpful, right? I have a fair number of patients who, when they get stressed, they smoke.
Mm-hmm.
So they get stressed and they say, okay, I'm gonna have a cigarette and I'm gonna calm down, right? So they make a decision, like, but it happens so fast because it's mindless. It's such a habit that they get the stress, boom, they go right out, they start smoking, they feel bad,
Yeah.
right? But they did make a decision. It just blew right through it. They didn't know. They're not aware of it. So starting to become aware that I'm feeling a certain way, and that, you know, now I'm making a decision about whether to smoke or not makes a difference.
Yeah.
Whether I'm going to drink alcohol, whether I'm gonna. Some people stress eat.
Mm-hmm.
It could be a big problem for them. So, sort of slowing down, taking a breath, and asking yourself, "Hey, how are you doing right now? How are you feeling? How are you feeling right now?" Becomes an important part of it, and that is mindfulness.
Yeah.
That's slowing down, and that asking yourself that question and answering that question. We do, you know, having the words for the feelings can be a problem sometimes. You just don't know how you feel. You don't have the words for it.
Yeah.
Um,
I
and
often
that's
say a lot of times people only know 3 or 4 emotions. They know
yeah,
if they're hungry, sad,
yeah,
mad, happy. But
yeah,
there is also, so many other emotions that we don't always know how to identify when we're
hmm,
experiencing them, whether it's anxiety, fearfulness, or even, being nonchalant or melancholy, or, whatever the emotion
yeah.
is. And so I feel like, language is really important too, especially, within the Black community.
Language is huge. It's
Yeah.
huge. And it's interesting. All the words you just gave us are words that would describe the situation where your needs are not being met. Right? Those are the words. So there are also words that you can use when your needs are being met, out past happy, right? So like content, for instance.
Hmm.
Um, so knowing the words makes a big difference. Um, but taking the step to think about it and apply it is kind of the first part of it.
Yeah.
And that's kind of where meditation comes in. Meditation is you taking some time to focus and practice focusing. Um, and when you do that, your focus gets sharper. Not only in the moment where you're meditating, but it gets more focused when you're doing other things. And sometimes when you're stressed, that focus comes into play. You can refocus on, okay, I know that I'm having these feelings. I feel the stress. Now I'm going to take just a breath and a moment to identify what's going on. Then I'm going to make some decisions about how I'm going
Yeah.
to manage. And the anchor for meditation in the beginning, when you're taught how to do it, is your breath, because you always have it with you, of course, and there's no charge.
Right.
You can,
That's about
you
the
can
only thing that they're
that's
not
about,
charging for.
that's about it, right? But you can use it, just being aware that you are breathing, um, and focusing on that is an exercise that helps you train your focus. It's not easy. Uh, I've been meditating now for, I don't know, 17, 18 years. And sometimes I sit down to meditate, and I can focus for minutes at a time, and other times it's seconds before I have to refocus, right? And that refocusing is the exercise. That's the thing that builds the muscle. Is
Okay.
that
That
my
that
mind
that
will
makes me feel a lot better. And I'm sure, people who are watching right now, all of our folks who are on the live stream, thank you for joining us. But I feel like that's what probably trips people out the most about meditation and mindfulness, and like sort of centering yourself, is that you lose focus and you realize that you lose focus. So then you're
yeah.
sort of like, am I meditating because I'm
Mhm.
losing focus? So is this even working? So it's good to hear from someone as yourself, who's a doctor, who's an academic, but also has been meditating for so long, say that even you sometimes
Yeah.
may have moments where you lose focus and have to
Yeah.
reset.
And in fact, the moment you realize you lost focus, that's the victory. You just
Wow,
realize
that's good.
my mind wandered. I'm going to bring it back to what I intend, and that is to sit and focus on my breathing. The moment of realization is the victory, and you might have many victories while you're doing it, um, but that's the important part, that you recognize it.
That's good. That's good, Dr. Rubin. Now, with you being an academic as well, can you talk a little bit about your perspective, if there is any research or any science behind um, mindfulness, meditation, as it relates to stress management and heart health?
Tons, absolutely tons.
Why are we
Um,
not doing it more? I feel like
that's a
my
question.
generation, I guess they consider me a millennial. I'm 34, right? So
Mm,
I feel like a lot of people in my generation, even myself, are like very, focused on it. Almost has become like a trend, like on social media, but really focused on, wellness, and fitness, making sure we're working out. It's a
mm.
Pilates princess this and run club that, find your boo like at the run club, and
Yeah,
we're all buying organic and all the things. So I
yeah.
feel as though we're starting as a community, like generation by generation, starting to do, better and better with how, we eat right and exercise. Um,
Mhm.
but I don't know if we've got to the point where we're like, no, like meditation and the mindfulness really works, y'all. Like it's science behind this. It's not just
Yeah,
a fad or something that we're doing.
yeah, yeah. Definitely is not a fad. It's been around too long for that. The it's interesting. Like I've done courses. I've done training. For myself, and I've had opportunity to talk to many people who practice, who train other people to do it, that kind of thing. And the most startling thing I hear people say is that it changed my life.
Yeah.
And it always gives me, I'm like, it changed your life? Really? Is that what happened? How did it do that? Um, and then, my own experience, of course, you know, changed my life. Like I'm a different person than I was 20 years ago. Um, things just look different.
Yeah.
And that's the important part of it. Why isn't there more uptake? And if I can summarize your question, um, that's an interesting question, right? For the people who know, it's always like, let me show you this. And there's variable amounts of pushback and willingness. And you kind of have to accept that. Some people just aren't ready for it, ready to do it. And some people have different hangups about it and different ideas about what it is and what it isn't. Um,
Mhm.
at the end of the day, it's about your relationship with yourself, and your relationship with others, and your relationship with your environment. And when you connect to that and you practice um, uh, being aware of how you're relating to people, you get an opportunity, you get a chance to make changes.
Yeah.
And we're all human, right? None of us are perfect, and sometimes we're going to get it right, sometimes we're not going to get it right. But that also is an opportunity, and you have to be aware that it's there. So, in my mind, one of my questions when I first started to read about mindfulness and meditation and really sort of look into it, was, why did it seem to work for everything, right? They were using it to help people quit smoking, to help people quit drinking, to help people not stress out. They're using it in mental illness with depression, psychosis, and all these things. And it's like, PTSD. And I'm like, why does this seem to work with everything? Um, and then one day it occurred to me, I'm like, oh, you're training your attention.
Right.
Yeah. What do you do that you don't use your attention for?
Right.
There's nothing.
Or that you
And
maybe use
so,
other vices in place of, training your attention. So instead
right.
you're going
Well,
to that cigarette or stress eating or,
right, right.
But
Yeah,
at least
you're
for
not.
mindfulness, you're sort of learning how to self-regulate without,
There you go.
engaging in those unhealthy behaviors.
Well, I would say it a different way. I would say you get a chance to decide.
Mhm.
You get a chance to decide. Some people are still going to decide that they want, right?
Right.
I have had some people who they smoke, and
And they not finna stop.
there you go. They're not going to. They're on oxygen and they're still smoking. And
Wow.
and so my job as a doctor is to say, okay, smoking is really bad for you, right? Here's some things that may help you. Um, and they're like, I'm not going to quit. I'm like, so be careful. You have oxygen on, you're going to burn your face, right? I've seen that. It's bad. Don't do it. I know I've had patients burn their homes down. I've
Oh,
had patients burn other people's homes down. It's bad. It's a bad idea.
for a
Um,
cigarette.
well, that's what addiction looks like.
Yeah.
That's addiction, right? It's the decision to do it regardless
Yeah.
of myself, regardless of other people, and it can be damaging. But everything counts. So I tell my patients who decide they're going to use nicotine patches. They say, "Am I going to quit?" I'm like, "Some people do. Most people don't. Um, some people cut down though. They smoke
Yeah.
less,
And that counts.
and oh, it counts. Absolutely, absolutely. They smoke less,
Okay.
and they're on their way. You're getting yourself in the right lane for it, and whatever you can do to help yourself get in the right lane, I think is worth it.
Yeah, yeah. If you are just tuning in to our latest session of building up the heart of the community, this is taking care of your heart with Dr. Darrell Rubin. We are talking about heart health, heart disease, how it is affecting our community, and how we can do a better job at taking better care of ourselves. Not just with our eating, but also with our physical health, the way that we exercise and move our body, and also how we manage our stress and our emotions. Because if you let this world drive you crazy, it absolutely will. And it might actually drive you to the grave as well. It sounds like I'm making a joke, but seriously,
You know,
I feel like a lot of our health issues, come from stress.
I'm glad you said it that way. Let the world drive you crazy, because there's an idea that sort of comes along with mindfulness, and meditation, is that the idea is that you generate your feelings.
Mm,
Like no one else can do that for you. No one else that has that power or authority.
right.
You do that, right? If you're angry, you're doing it. If you're happy, you're doing it. If you're sad, you're doing it.
Hmm.
And I think for me, like the powerful part of it is that once you realize you're doing it, you get to make a decision. You can change it. You have that power. Like you always have. That's always something that's for you. Nobody else can do it. You can do it. And people who are angry, like, well, I want to be mad right now. And I'm like, okay, well, you making that decision, that's okay. It's okay to be upset, right? It's okay. Some people are like, I'm sad right now, and I want to be sad. Something sad happened. I'm like, that's fine, right? You can make that decision. But you also get to decide when you want something different.
Yeah.
And that's the piece that I hope people take away, is that they get to make a decision. And the first step is to be aware that they can.
Yeah. Now we have about 6 minutes left here. I want to invite anyone who may be watching the live to feel free to drop any questions for Dr. Rubin in our chat, any comments you may have, personal stories. We would love to hear from you and have a conversation with you. Again, thank you for everyone who has already dropped a comment or a question in the chat. As we are waiting for some potential new questions to come in, Dr. Rubin, we want to switch gears a little bit and talk about research, innovation, and sort of the future of heart care, especially for people who may already be dealing with high blood pressure or heart disease, may even have high cholesterol. What right now is the University of Maryland doing? What's some of the new technologies or new things that you all have uncovered when it comes to heart health and heart care?
There's so much. Since I started studying medicine, the rate of change is almost at a sprint
Wow.
compared to when I started. Yeah, it's the number of options that we have for lowering the cholesterol. There's 4 or 5 different classes of medicines that are in common use now. Some things that we don't even use anymore. They're just not. While they were effective at the moment, at the time, there's so many better things now. The statins are one of them, but there are many others. Medicines to control the blood pressure. It you know it Again, lots of options. Uh, uh, the I think one of the biggest things that has changed since I started studying medicine, um, in '97, is this idea of sort of monitoring blood pressure. It used to be that monitoring blood pressure in the office was the standard. You come in, you sit down, we take your pressure, and then you go away. We treat you based on that. And then somewhere along the way, we discovered that some people have normal blood pressure in the office, high blood pressures at home, or the reverse, high blood pressure in the office but normal at home. So we're like, what do we do with those people? How do we deal with them? And then the ambulatory blood pressure monitor came on the scene, where you put the blood pressure monitor on your arm and you take it with you, and it measures your pressure every hour, and then
I've seen those. Yeah.
yeah, and it's fascinating. I think it's every half hour. I'm sorry, during waking hours, and every hour after, during sleeping hours. But it gives you a much better look at the sort of blood pressure landscape, if you will. Um, the estimate of that, the sort of the rough estimation of that, is taking your pressures at home, and if that's taking more of a center role in blood pressure management these days. Having people checking it at home. I know we talked about that already, but it was a good place to reinforce that idea. Yeah. The other things that are going on at the University of Maryland in terms of heart health, they have just a outstanding interventional cardiology division. They're cardiologists, but they subspecialize in intervention. So they do mechanical things to the heart and the arteries to fix things, putting stents in, but also replacing valves. And they can replace almost all the valves now. They recently started replacing the tricuspid valve, which is one of the more complicated valves that opens to let blood into the heart, and then closes as blood gets pumped to the lungs.
Oh, wow.
Yeah.
I feel like University of Maryland has always been just very, progressive and advanced, and
Absolutely.
research, and how it develops new technologies and new ways to care for the patient. And I know in other departments, I think this is true for cardiology, from diagnosis to, treatment to, post-treatment care, follow-ups. University of Maryland kind of has it all. So I do want to encourage anyone who is watching this episode of Building Up the Health of the Community. If you know someone, or if you yourself are experiencing health issues, or maybe you might even be feeling symptoms of heart issues, someone who is going through that currently. I honestly feel like we all have 1 or at least 2 degrees separation from someone who is experiencing heart issues. Please make sure that you visit the University of Maryland for more information about the programs and services that they have at the Midtown campus. You can visit ummidtown.org/heart, or call 410-225-8000. That is right at the bottom of your screen as well. Now, this session will be available for replay. So if you are just tuning in and you're like, what? I missed the whole live already. Wait a minute. I had a question. Don't worry. It will be available for replay. You can watch it again in full, and also share it with any of your loved ones, family members, coworkers, anyone who you think may benefit from this information. And of course, you can reach out to Dr. Rubin as well. Dr. Rubin, what's the best way for us to reach you?
There's a number scrolling on the bottom of the screen. Call that number, the 410-225-8000, and let them know you want to connect with cardiology, and you can mention my name in particular, and they generate a message that goes to my staff, and then they will get you an appointment.
Yes. Now, Dr. Rubin, one last question. I always ask all of my guests this at the end of our session. If someone is watching right now and they didn't hear anything we said, I mean, it went in one ear and out the other, what is one thing that you would want to say to them right now that you would want them to take away from this?
Can I get two things?
Yes, absolutely.
Eat right and exercise.
There we go.
All right.
There's no getting around it. There's no getting around it, family. Okay. we got to do it. We can do at least 15 minutes a day, at least.
Yeah. If you think if you can only do five, do five. Whatever you start with.
Five, right. And if you can
everything counts.
Do two.
Everything counts. Yeah, absolutely.
Yes. Thank you, Sheena and Anderson. We appreciate that. Thanks again, Dr. Rubin. I hope that we will be seeing you again for another session of building up the health of the community. And of course, this episode was called Taking Care of Your Heart. We appreciate you for taking care of so many hearts as you do every day.
You're welcome. Thank you for having me on your program. I really appreciate it.
Thank you.